Welcome everyone to today's webinar, Supercharged Payment Velocity, Insights on Yale New Haven Health's Revenue Cycle Evolution. I am Molly Gamble with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be made available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Rob Stucker has 19 years of experience in the healthcare software industry, where he started out working for a California-based company named Data Systems Group. Rob soon moved up to become the Chief Operation Officer before moving on to Passport Health and finally to Experian Health in 2013. Rob currently serves as Senior Vice President of Revenue Cycle Management and works with Experian Health's dedicated claims teams located in Sacramento, California and Schaumburg, Illinois, which together develop, implement, and support Experian Health's claims source suite of products. I'd also like to introduce Jennifer Amiri. Jennifer has 18 years of experience in healthcare, beginning with her journey as a pharmacy technician and later joining Yale New Haven Health as a medical coder. During her time at Yale, she has held the roles of specialty coder, coding educator, and is currently a revenue cycle system analyst for the corporate business office. Jennifer has 6 EPIC certifications in various areas of the revenue cycle, along with CCS and CPC coding certifications through AHIMA and AAPC, where she is a member. Finally, I'd like to introduce Mark Rodriguez. Mark has 24 years of experience in revenue cycle management and currently serves as a Senior Manager of Accounts Receivable at Yale New Haven Health. Mark oversees the billing and follow-up activities for all third-party, governmental, and non-governmental payers for the health system's 5 hospitals. Mark is AHAM and EPIC certified and is the AHAM Certification Chair for Connecticut. He also served as the Chair of the Patient Account Managers at Connecticut Hospital Association. At this time, I am pleased to turn the floor over to Rob to begin today's presentation.
Thank you, Molly, and thank all of you for joining us today. This is just a quick view of the agenda. We just want to kind of touch base on some denial pain points, talk a little bit about Yale New Haven, give a little bit more background into their journey off of this, talk about future developments, and then, as Molly mentioned, there will be question and answer period at the end of the presentation. We know that when we ask CFOs or directors or VPs, what keeps you up at night, one of the topics that comes up constantly is usually number one on the list is just with regard to handling denials in there. The pain point of identifying and then prioritizing the denial, so you're spending your time on what's going to give you the biggest impact, because there is always a time constraint, and there's always the dealing with the inconsistency from the payer rules that seem to change on a regular basis. And in dealing with all that, you always want to make sure you're holding everyone accountable, because we know the ultimate goal is to keep the cost of patient care as low as possible for the patient, as well as for your own facilities. So you want to make sure that things are billed accurately. You want to make sure that things are most efficient through the whole process, from your billers to what you're doing in any type of automation. And the goal is always going to be, how do I improve things? Where can I find some efficiency gains through our internal processes? And that's not just at the CFO level. We know it should be through the whole system. So part of what we want to go through today is to let you take a look at how Yale New Haven Health took on a challenge to get a better hold on their payment velocity and how they can streamline things. And that is what Mark and Jennifer are going to go through with you in more detail. So with that, Mark, I'm going to flip it over to you.
Okay, excuse me. Thank you, Rob, and good afternoon. Thank you, everyone, for joining today's presentation. As mentioned, I'm Mark Rodriguez, Senior Manager of Accounts Receivable. With me is Jennifer Mary, a Revenue Cycle System Analyst, and we're from Yale New Haven Health. And we're going to take you on our journey with the experience enhanced claim status and integration with Epic Systems to improve workflow efficiencies and our payment velocities. Just to give you a little bit of background, Yale New Haven Health's mission is committed to innovation and excellence in patient care, teaching, research, and service to our communities. Our values are patient-centered, respect, compassion, integrity, and accountability. This is giving you a snapshot of Yale New Haven Health. I won't go into all these, but to highlight that we have 5 delivery networks. We have a system physician foundation, Northeast Medical Group, with over close to 1,000 providers. We have an academic affiliation with Yale School of Medicine. We employ over 27,000 employees, and we have $5 billion in annual revenue for the system. Just showing you our footprint throughout the state of Connecticut. We are throughout the whole state. We even have reach into New York, and one of our delivery networks is in Western Rhode Island. So this is the community in our state and the areas that we serve. Taking a look at our claims, we went live with Claim Source May of 2017. The top graph is illustrating our payer mix. We have a high payer mix of Blue Cross, Medicare, Medicaid, and commercial plans. The lower diagram is giving you a snapshot picture of how we transmit our claims. Overall, we submit 97% electronic. We do print 1% on site, and about 2% are done via experience print fulfillment off site. But overall, we're 97% electronic claim submissions. So what is enhanced claim statusing for those who don't know? Enhanced claim status eliminates manual follow-up tasks, lets providers respond early, take accurately to pended, return, provider, denied, or zero pay transactions before the ERA or EOBs are processed. We went live with experience claim statusing January of 2018. When we went live, we decided to create a committee for this project with revenue cycle operational managers, follow-up specialists, our system analysts, and also the help from Experian. Our committee had 3 goals in mind when working and looking at claim statusing. We wanted a systematic way to find statuses of our claims at the payer. We want to know, okay, did they receive them, but are they in process to pay or reject? Will they pen for additional information? Are they set to deny? We were also looking for a way to eliminate the transactional or the non-added value work from our staff. We thought by eliminating the volume, allow staff to focus on their efforts on the problem accounts that need true follow-up. And with that, we thought this would help with increasing our payment velocity by taking a proactive approach, correcting claim rejections or denials before the remit is posted would allow us to get paid quicker. This slide shows you the category and status codes that we use in our claim statusing review. The table on the left are the category codes, which are a high-level reason of the claim, where the claim's been, what the status of the claim. On the right are the status codes. These are a little bit more detailed. We quickly realized with status codes, there's hundreds of codes. Every payer does not use these codes the same, and the meaning of the status might not be always the meaning what the payer is intending to tell us is happening with our claim. So we kind of had to go through trial and error on this and figure out what the payers are giving back to us and understand what they really were telling us and who was giving us back these responses. So we started looking at the information coming back. We had to determine what payers we were going to start claim statusing with. Do they have websites? We initially wanted to look at payers that had websites for us to validate easily. We took a data-driven approach to kind of look at past claims that have statuses and what was coming back from those payers, what the volume was, what types of codes we were getting back. But then we really had to do a validation process, and by doing that, we had to take real-time responses back from our payers and validate what we're getting back as a claim status. We compared it to the payer website, and that's why we thought it was important to start with payers that have websites, So we helped in the validation process of looking at the status coming back, making sure what the payer says is they have on file matches what the status is coming back. And of course, we found that each payer uses the status differently, so we really had to look at each payer separately and understand what was coming back. Not only did we have to decide which payers we were going to status, we also had to decide when we would start a statusing. And originally, we had everyone set to status at the same time, so many days after bill date, but we quickly realized not all the payers are the same. So for example, you're seeing ARP, the initial status check, we checked 10 days after bill date. We found that with ARP, through trial and error, if we statused any claim prior to 10 days, we would get the claim was not on file. So with ARP, it wasn't until the 10th day when we did a status check that we found our claims were there and we were getting statuses back from that payer. But if you take a payer like Medicaid Connecticut, we could status a claim 2 days after bill date and get a status of what's going on with that claim. So it's really payer by payer. It's not cookie cutter. We had to check each payer, again, doing the validation process, figuring out what the status is coming back, that they're not all the same. We also then had to decide how many days would we status a claim. And we decided right now that we're going to status a claim 11 days after the initial check. So for example, Aetna, we status 5 days after bill date. We're going to keep statusing every day for 11 days or until we got a desired response that we could do something with. So for United Healthcare, we'll status day 7 after bill date. If we don't have a desired response, we'll continue to status up until the 11th day. After that, the claim will fall back into the normal workflow process that we already have set up. Once we received all the responses back and understand what the payers are doing, who was giving us what information back, we kind of had to operationalize all this and how to make it work for us in our health system. We came up with 3 category codes that we would drive the responses back. We had, informational only, actionable, and deferred. So the informational only, although they're important, we really can't do much with them. They're not routed to staff work queues. It's just letting us know what's going on with the claim. For example, acknowledge a receipt or accept an adjudication system. So it is good information, but we can't take action on that. We just know the payer received it. Our actionable statuses, now this is an important category for us because this is statuses that we can take early action on. These are status codes that we decided to take a proactive approach and work prior to the remit. These status codes indicate the claim is set to either reject, deny, or pend. These types of statuses, we have those claims routed to staff work queues in Epic so they could work the account prior to remit being posted and get the information back out to the payer. Example of some actionable statuses are acknowledge not found, finalize deny, or pend for additional information. These are ones we look to see what payers can we take early action on prior to remit. Is it worth taking the early action and let staff work these sooner than waiting for remit to post and then tackle these rejections? To give you an idea of early action, I have some payer examples. So like Cigna. Cigna is a payer that likes to pend claims for 90 days. They don't adjudicate to a remit. They'll just pend the claim waiting for additional information. So previously, with our workflow, we don't have claims go into our follow-up work queue to 30 days after bill date. So we wouldn't know until 30 days later that the claim is pending in the Cigna site and needing additional information. But now with claim statusing, we status Cigna 5 days after bill date. So we know 5 days after the claim is billed that it's pending in the Cigna website. We could take action on that, send Cigna what they need 20 days earlier than we would in the past. This would allow the claim to get paid quicker and not sit in staff follow-up work queues for long periods of time. Another real actionable payer example is Medicaid Connecticut. For Connecticut, Medicaid has a bi-monthly payment cycle. Claims are processed, but they suspend in the payer system until the cycle is released. We are lucky enough to be able to update our claim while it's in that cycle. So if we get accounts back with an actionable status that we could take early action on, we could fix that claim, send it to Medicaid, it will recycle itself within their payment cycle and pay us correctly the first time. So that helps us get the payment in first clean and avoid the denial or rejections coming in. Also with Medicaid, since we can update the claim while it's within the cycle, we decided to work our Medicaid late charges sooner. Typically, we wouldn't work a late charge until we get initial payment, but because it suspends in the payer system, if we have a claim that has a status indicator of in process to pay and a late charge hits, we systematically will send that claim back out to Medicaid, let it refresh in their system, and get a first-time payment, including the additional late charges that we recently billed. So this avoids reworking claims. It has less touches for the staff, not only for billing, but also for payment posting as well. We recently started statusing Medicare, FIS, DDE, the TB 997 rejections. These are rejections that they don't adjudicate or admit. Staff typically have to go out to the Medicare website to work. We started statusing these TB 997 rejections back into Epic. That way the account can be worked in Epic, documented what's going on in the FIS system, corrected in Epic, and then sent back out to the payer. Once it's resent back to the payer, then we'll be able to restatus since we sent it back out through Epic. We're looking more into this and see what more we can do with data reporting and what's coming back in TB 997, but it's really able for us to pull the Medicare system back into the Epic system and document it on the accounts. Deferrable status, this is another win for us. This is an important category for us. These are statuses that come back that we decide that we want to defer. So in Epic right now, accounts with no payment, they qualify for our staff work use 30 days after bill date. But there was high volume of claims, and when staff would make an inquiry, the payer, it was just in process to pay. So if we systematically know that the claim status is set to pay, or we know it's going to deny and we're not going to take early action on it, we were able to modify our Epic work queues to defer those claims out. By us deferring all those claims out that are in process to pay, this left fewer accounts in the staff work queues that needed true follow-up. We did build a safety net, however, that if the claim has a status to pay or deny, and it's been past 45 days and no remit is posted, then it will fall back into our workflow. Otherwise, these are pushed out. Staff are not seeing them. They don't have to touch them. They don't have to just document that it's in process to pay. They're deferred out of their work queues, and they have time to focus on accounts that really need attention. And by removing the deferred accounts out of the follow-up work queues, we looked at velocities by payer, and we're now able to lower the number of days of accounts that did not have a deferred or actionable status to qualify for follow-up work queues. So for many payers, we went from 30 days after bill date to anywhere from 15 to 18 days they would qualify for follow-up. This resulted in us working accounts sooner and increasing our velocity of payment. So the three categories, the two major ones, are the deferrable and actionable statuses that we take with claim statusing. And I'm going to turn it over to Jen and Mary.
Thank you, Mark. Good afternoon, everyone. My name is Jennifer Amiri, and I am a Revenue Cycle System Analyst for Yale New Haven Health. And today I'm going to talk to you briefly about our technical build for enhanced claim status. As an organization, we decided to go with the X12-277 file format for an enhanced claim status setup. And that was because this file format just seemed to work better for us as an organization and what we were trying to do. As Mark mentioned before, we split the category and status code combinations into three main groupings: informational, actionable, and deferrable. And we linked each of these groups to a designated code in Epic that would allow us to route the accounts to the appropriate work queues to be worked by staff. At the beginning of the process, we labeled everything as informational, which meant we didn't have any special routing rules in place. The accounts just followed their normal workflows. And this allowed us to see the information that was being pulled into Epic and how we would be able to access it and utilize it. And it also gave us a chance to run reports on our claims to see which statuses were being used by which payers. It's probably no surprise, to hear, like we said, that not all payers use the same status codes, or that some codes are not being used as they were intended. So this is why it was essential for us to be able to determine which of our payers are using which status codes and what their intentions were for those codes. This was the work done by the committee that Mark had mentioned. We took claims that had been statused in the morning and checked those claims against the payer websites that same day. And that allowed us to validate the information that was being sent regarding the status codes, just to make sure that what was being said on the website matched what the status code was labeled as. And once we determined that piece, it was easier for us to decide what we wanted to do with the statuses once we've received them back in Epic. We built our work queue rules based on the designated codes we had set for our 3 main groupings. We routed our early action accounts to specific work queues to be worked by the billing staff, and we excluded our deferred accounts from the follow-up work queues for a set amount of time. And we typically defer accounts for either 45 days or until the remit comes in. And like Mark mentioned, the majority of what we're deferring from the work queues are the accounts that are either in finalized payment or finalized denial status. And this is because we have to wait for the remit to come in before we can take any action on these accounts. And so this process allowed us to reduce the number of days accounts wait before they hit the follow-up work queues. Historically, we waited 30 days, but we did extensive reporting on payer velocities to determine how long it takes each of our payers to send their first remit after a claim submission. And so, for example, for Aetna, typically it takes around 12 days for Aetna to send the majority of their remits. And so we set the Aetna follow-up work queue to catch accounts that are not deferred at day 15. Because what we're saying is that by day 15, we should have either received a remit or we should have received an enhanced claim status code that tells us what's going on with the claim. And if we haven't received either of those by day 15, we need to start following up with the payer to determine what the issue is. So this process greatly helped us to increase our payment velocity. We also created a correspondence workflow in Epic for the accounts that we take early action on. For example, for Connecticut Medicaid, we route several denial statuses to the billing staff to be worked early. However, that denial staff on these accounts does not change once it's there. So we needed to develop a way to remove these accounts from the work queue once the early action had been taken. And the correspondence workflow is how we accomplish this. When a user completes their early action, they open up a correspondence record on that insurance bucket, and then we have rules built into the work queue to say that accounts with that particular correspondence record no longer qualify for that work queue. And this helps us to just clean up the early action work queues and allow staff to only focus on the accounts that still need to be reviewed. And then once the remit comes in, the account will follow its normal workflow. Our organization sends multiple claim runs out of Epic into Experian every day. We also pull in statusing information at 4 set intervals throughout the day. We start around 5 a.m. and then end around 9 p.m. And this enables us to have the most up-to-date status information on our accounts throughout the day. So here we have a depiction of the impact our enhanced claim status go live had on our billing follow-up work queues. This is the initial 6 months worth of data after go live, once we had operationalized and finalized a lot of our workflows. The routing rules we put into place regarding the enhanced claim status information allowed our staff to focus on the right accounts at the right time. And so you can see here that we saw a steady decline in both the number of accounts hitting the follow-up work queues and also in the average number of days an account sits in the follow-up work queue. We also saw an impact in the percent of first response zero payments we received. So these are our rejections and denials. And you can see that the early action we're taking on these accounts is helping to prevent that rejection or denial from coming in on the first remit. Instead, we're receiving payments because we're able to correct whatever issue was causing the claim to reject. So we're able to submit a corrected claim before the payer processes the remit for that rejection, which is speeding up the payment velocity for us. And this slide here is also showing a decline in the velocity of average discharge to last claim. So this shows that because we're receiving the enhanced claim status information, we have a better understanding of what's wrong with the claim and also exactly what we need to do to correct it. So this allows us to better target the issue and send just one corrected claim in order to receive that payment, which again is greatly increasing our velocity of billing. Epic rates their customers in different metrics throughout the system. And you can see here that enhanced claim status helped us achieve a gold cup in both our percent of aged over 90 and our percent of insurance over 90. Here are some of our future developments that we're working on. We currently are only receiving EDI information for our payer Connecticut. And this is because there's a stop on the Connecticut website that says, I am not a robot, which prevents us from statusing these claims. So Experian is working with Connecticut to develop a connection that enables enhanced claim status to access the website and bring back that status information into Epic for us. We currently receive additional information from some of our payers other than just the category and status codes. An example of this is the set dollar amount that a payer will be sending on the remit for an account that's in finalized payment status. But this information is displayed in a message field within Epic, and that message field is not delimited. So we're working with Experian and Epic to be able to parse out that text string into separate segments. And that'll allow us to utilize that information to route accounts more effectively based on the information the payer sends in that message. Currently, we choose not to take early action for some of our payers. And this is because when we do take early action on a rejection or denial status, we still receive that rejection or denial on the remit that comes in. And we're trying to avoid having the staff work these accounts twice. So we're exploring options to improve this workflow within Epic, and Experian has been helping us with this process. And like Mark mentioned, we currently have a workflow in place for Connecticut Medicaid with late charges. When the late charge comes in and the account is set to pay, we process the late charges earlier than we normally would and send the corrected claim. And if we're within the same remit cycle, the corrected claim will overwrite the original claim in the Medicaid system and we'll receive payment for all the charges when the remit comes in. And so we're exploring this functionality with some of our other payers to see if they'll handle the corrected claims the same way, which would allow us to process their late charges early as well, also increasing our payment velocity. So this concludes our presentation, and I'm going to turn it back over to Molly. Thank you.
Thanks, Jennifer, and thanks, Rob and Mark, for that fantastic presentation and all of this valuable information in the slides. So attendees, we will now begin today's question and answer session. You can submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try and get through as many of these questions as we have time for today. So let's see. Rob, Jennifer, and Mark, some questions have come in while you were speaking. This first one I'll pose, and I'll just open it up to the group here. You know what? I'm going to have to ask Daniel for some technical assistance to access these questions. I'm having a bit of a problem with the dashboard on my end.
No problem at all. While you want to refresh your page, I'm also happy to pose the first question for our presenters today.
Thanks, Daniel.
So our first question that came in was, what was your biggest hurdle to overcome when you started this project?
I think our biggest hurdle was first getting everyone time to look at what's coming back from the different payers and understanding the information coming back, because as we mentioned a few times, every payer uses it a little bit differently, and we kind of had to figure out payer by payer what they're trying to say or what is the status of our claim. So really the time, setting it up, validating the information coming back, I would think is one of our biggest hurdles initially.
Is there anything else you would add to that in terms of biggest hurdles you had to overcome, or what attendees with us should expect as possible hurdles as they start these endeavors?
Probably outlining which payers are able to use claim statusing. We started off with payers that had websites because we needed to validate, and if it's real time, and if you get the statuses in the morning, we had to have staff be able to go out, check the site, see what the status is on their site. If we had to make phone calls to the payers, we would be there, we wouldn't get much done. So we started with payers that have websites, that we could go out, validate the information to ensure that what we're getting back in the claim status is what the payer is really saying. Or doing it that way, we can identify, well, the payer is saying this, but the status is saying this. And for that payer, that status means this all the time.
Perfect, thank you. Mark and Jennifer, I anticipate this question is for your perspectives, but Rob, I'll also open up to you to add on any other thoughts. But this attendee would like to know, why did you choose to only start with a few payers instead of all of them?
So I think that kind of goes back to time, number one, and also it takes time to go through each payer and what they're saying. So if we just gave us a blanket of all our payers, trying to decipher which category goes with which payer, it would get very cumbersome and it might not be as accurate. So we felt that if we take payer by payer, the staff in our committee know those payers, they know how to navigate through the websites, they know what to find and what to look for. We felt it was just more concise, that if we take it payer by payer, we'd understand the statuses better from that payer.
Yeah, and I would absolutely. Oh, go ahead, Rob.
I'm sorry. Go ahead, Jen. Go ahead, Jennifer.
No, I was just going to say I absolutely agree with what Mark's saying. And like we mentioned, there's hundreds of status codes, and the payers are using any number of those codes any which way they want. So it's just very time consuming. It's a lot of data in the beginning to trend through and figure out who's doing what. So yeah, I agree with what Mark had said.
Yeah, and this is Rob. I may expand a little bit on that. When you get a normal claim status, just your standard 277 response back, and you get your claim status codes in there, there is a limited number of those. I forget the exact number. It's like 785, something like that. But when you actually go to a payer's website and you're looking into their site, there are hundreds and hundreds, if not thousands, of proprietary codes and descriptions that you see on the website that you don't get when you just do the normal 277 response. And so, and that's what Mark and Jennifer are referring to in there, is that there's a tremendous amount of additional descriptions and codes when you actually get to that proprietary level of information. We did just a quick search with one of our clients just over a 30-day period. I think it was with United Health, and just pulling the information on one ANSI code and seeing how many of their proprietary codes that they rolled up into that one ANSI code when they sent out a 277. And we found, I think the highest number we found was 90 different proprietary codes and descriptions that rolled up to one ANSI code. So that's why we're saying, going to the actual payer's website and pulling that proprietary information gives you a much more detailed, higher level of data, and trying to do that with a big number of payers. And I know a lot of clients want to do all their payers, but what I really like about Yale's approach here is that they're very methodical and took it, in smaller chunks, and I just think it's more efficient because you learn more by taking a focused approach versus a shotgun approach.
Terrific. So a focused approach and starting off with a few pairs instead of all of them because it's just so much data to work with, and then also, Rob, the complexity of that proprietary data and those proprietary codes can be overwhelming if you start with too many pairs.
Correct.
Okay. Another question from attendees here is, I think, just looking for a bit of the bigger picture and the why, but what made you focus on prioritizing your work queues to begin with? Jennifer and Mark, can I turn that to you first for your reasoning at Yale? And then Rob, perhaps you can expand on what you're seeing across the board or with other organizations.
We really needed to prioritize our work queues to know what are we going to do with those statuses coming back. As I said before, if it's informational only to a staff member, okay, they received the claim, but they really can't do anything with it. That's why we broke out into chunks or category codes for the deferred. Deferred right off the bat was a win because we could pull stuff out of the staff's work queue. So our goal wasn't only just to what qualifies for the work queues, but what could we not have qualify for the work queues. Let the system do it on its own. We already know what the status is coming back. We didn't want to have that all sitting in staff's work queues. There's volumes of accounts, and if it's just really to document and process to pay, we thought one of the biggest wins of claims staffing was pulling that work out of the work queues. But then we also wanted to say, for what payers, what could we take early action on? What could we focus on, help turn around fast to bring in the cash? We wanted to be able to know the statuses and know the errors, make sure we can fix them, because some things you can't fix until the payment's posted. We need to make sure, taking it payer by payer, that if we have a status that's going to be a denial or rejection, can we fix it ahead of time? Or do we actually need the claim to pay and post before we take action? So we really need our work queue set up in Epic because all our work is driven from the AR system that we need to make sure it works for our staff and our everyday work. We couldn't work separately and have Epic and our work in one system and then know our statuses and things going on with claims in another system. We really need to marry the two up and able to work the claims in Epic since that's the source of truth.
Thanks, Mark. And so it sounds like just approaching that work queue much more strategically. Rob, is that in line with what you're seeing elsewhere? Is there any other common reasoning or context that you think is worth sharing with this attendee?
Well, yeah, I mean, I love the fact that, their approach was, instead of first looking at, what denials do they need to fix, Yale took the approach of, okay, how do we, sift through everything and take out what we know they don't need to touch, whether it's just informational or stuff that's marked to be paid in there. So just taking that off of, the stack to review, I think, was a big improvement right from the get-go. As far as work queues in general, we've seen it handled different ways with various clients. If it's someone who is already set up, let's say in Epic or any other system, and they already have strong denial work queues set up, then our recommendation is, hey, take these responses, and let's figure out how to map them to your existing work queues, assuming that setup is working for you. If it's not, then this becomes a good opportunity or excuse, whichever way you want to phrase it, to kind of reevaluate your follow-up work queues, and make some changes at that point in time. So there's not a hard, fast rule. It's really, what works the best for your organization. I'm a firm believer, hey, if it ain't broke, don't fix it. So if your follow-up work queues are designed in a manner that they're working correctly for you now, then let's feed into those existing work queues and accelerate the information in a much faster time frame. If it's not working for you, then I think it's a good opportunity to maybe take a step back and say, okay, how can we tweak this? What maybe could we do a little bit different off of this? And also, I just want to make sure we're talking about Epic because that's what they use, but these responses can also be sent back and interfaced into whether it's Epic or Cerner or NextGen or Meditech or whatever. It's not just Epic only, but with Yale using Epic, obviously we're using that as the prime example.
I do want to also point out that you also need your staff buy-in in all this because they are the owners of those work queues. So when they hear that we're going to be pulling all this work out of your work queues, the first things that come to their mind is, am I going to lose my job? Am I not going to have enough work? But we felt that pulling the work, the transactional type work out of their work queues allowed us to give them additional work that needed true follow-up. I think through all this, you need to make sure that you have staff buy-in and explain to them through the whole course of this what you're doing, because they're the ones that know best. And you want to reassure them that we're not looking to take staff away or cut positions. We're just trying to make it more efficient for you to get to the accounts you really need to get to. So I think that's another important piece that we didn't put in our presentation, but you definitely need the staff buy-in and the reassurance that you're there to make it more efficient and get to the more accounts versus just taking away work.
Right, and I would second that and say, the culture nowadays is, you have to do more with less. So having the ability to pull out that transactional work and have the staff focus on the accounts that, might take a little bit more time, might take more research to figure out what's going on. It's really that value-added work that they're able to do, which, has just been, really a great win for us. And also, just to echo what Rob had said about using this opportunity to look at some workflows that you already have implemented in your system and just, take a second look at it and say, well, we set this up at go live and we haven't really gone back to reevaluate. Maybe it's time, maybe there's some tweaks that can be made, or, how can we really improve this workflow? And, that's kind of what we did when we spoke about reducing the number of days it takes for accounts to hit our follow-up work queues. Historically, it's 30 days across the board, every payer. That was just kind of an arbitrary number that we had set at go live to say, okay, we're not going to have accounts hit follow-up until 30 days after claim date. But, throughout this whole process, it allowed us to look into that and say, well, why did we pick 30 days? Should it really be 30 days for every payer? Some payers only take a week to send a remit. Some payers take 45 days to send a remit. So it's really payer by payer, and it just allowed us to take that data-driven approach and look at, the payment velocities for each of our payers and go systematically payer by payer and say, okay, one payer is going to be set to 12 days, one is going to be set to 20 days. It just better allowed us to be able to attack the work that needed to be reviewed, right now, rather than having the work queues cluttered up with that transactional type work that was just eating up, the staff's time throughout the day.
And with all this, you're not going to be able to tackle every payer with claim statusing, but your major payers, your high volume payers, they do offer claim statusing, and we took advantage of that, and we feel that deferring or early actions helped us a lot. We're hoping to work more with working rejections right from the beginning, and when the remit actually comes in. So if a payer says they need medical records, we send them records. Yeah, the claim's going to process because now they have records, but we still get that initial denial. We're working with Experian to figure out how can we avoid working that original rejection when it comes in.
Terrific. Thanks, panelists. So it sounds like the biggest why is, I think I'm hard pressed to think of a team that wouldn't benefit from taking out any work from the queue that you know they don't need to touch, and thus letting them focus more on that value-added work that you mentioned, Jennifer. We've got a couple questions left here, and then we'll move on to your closing thoughts before we conclude our webinar today. This next question is there an existing EPIC standard report for payer response time, or do I need to work with my reports team to create one?
Yeah, so unfortunately, I think the answer is no. We did utilize one of our report gurus to create those payment velocity reports for us because we didn't have anything standard within our EPIC system that was going to accomplish that for us. So I think that might be the approach you need to take.
Okay, thanks, Jennifer. And then finally, with hindsight being 2020, what would you have done differently, if anything, if you had to do this again? Mark, can I start with you with this question?
What we've done differently, let's see. I think fully understanding the process, because, you know, like I was saying before, you're going to be pulling work out of staff work queues, maybe pain points of rolling it out, making sure everyone has buy-in and understanding of it would probably be something that we maybe would have rolled out earlier than in the middle of the process. Can't think of anything else that we would have done differently. Or
no, I mean, I will say what we kind of did, maybe we could have done a bit more, was even before our go-live date with enhanced claim status, there was a lot of work we did prior to that date, you know, trying to go through and, like we explained, you know, setting those groupings, deciding which statuses were going to be which type of workflow. I would definitely recommend trying to do a lot of that work prior to going live, just to make it more, you know, seamless once you flip the switch.
So rolling out an establishment, or I'm sorry, a process to get buy-in earlier on, if anything, Mark, is what you would say, and then also doing some of that work earlier on in the process, Jennifer. We have one final question that just came in, and I want to make sure we get to it for this attendee before we conclude, and that is, please elaborate on the process regarding late charge corrected claims.
Okay, so for late charges, for us historically, we wait for our payment to come in before we process a corrected claim with the late charges. So like I mentioned, for some payers that could be anywhere from 2 weeks to 45 days. So we started with our Connecticut Medicaid payer because they have that 2-week payment cycle. It's a set cycle. We know when the remitt's coming in. It was easier for us to focus on that workflow with that payer. So for Medicaid, rather than waiting for that next remit to come in before processing the late charge, we're getting our enhanced claim status information 2 days after our claim submission. So if, at day 2, we know it's in a finalized payment status, means Medicaid they're going to send that payment on our next remit cycle. If we know at that time that it's gonna pay and we've had late charges come in and hit that account, we have a system action set up in our system to say, if you see the finalized payment status and you see late charges, process that corrected claim as soon as possible. Send it in, and the hope is that if that corrected claim makes it into that same remit cycle the original claim was in, Medicaid is very good about overriding that original claim and processing the late charge corrected claim and sending the remit for the total charges. So like I said, we're exploring this for some of our other payers, but Medicaid was our major win because of that remit cycle that they have. But so it's just a combination of having your enhanced claim status information that says the payer is telling us they're going to pay for this claim. There's no issues. It's not going to be rejected. You're not missing any information. We're going to send you a remit for this. And then recognizing that late charges have come in after the bill has gone out the door, and the combination of those two, having your system, process your corrected claim as soon as possible to get it into the payer system, with the hopes that they'll overwrite the original and send you the full payment for your corrected claim.
And I think that's an area we would take it payer by payer to see how they would handle processing a late charge if they haven't paid us the original claim. Like Jen's saying, Medicaid, they have their system packaged for us to do it that way, but other payers may not. And it's just trial and error and working with the payer, working payer by payer to kind of figure out, can we do this if we have the process to pay status on, say, a United claim without the remit posted? Can we send the information, because we do get the payment coming in of what the payment would be. That's the part we're trying to figure out with Epic and Experian, that the payment, the prior payment is there. We just have to figure out how to get it there on the claim to then process the late charge. But it is payer by payer besides Medicaid. Like I said, Medicaid was a package for us, so it was a win. But we are exploring other payers.
Okay. Thank you for walking us through that in greater detail. So we are coming up against our time for today. So Rob, Jennifer, and Mark, I just want to check in with you and see if there's any final thoughts you'd like to share before we conclude.
I would just say that, oops, sorry.
No, it's okay. Let's go ahead and start with Jennifer and Mark, and then I'll follow up.
So I was just going to say, it is a very tedious, time-consuming process. Like I said, trying to do a lot of that work prior to your go live is your best bet, just to get a handle on your workflows, decide if there's anything that needs to be tweaked. In that sense, before flipping that switch will make it more seamless. But also that experienced support team has been excellent throughout this whole process. We still have a bi-weekly call with our enhanced claim status support team. Because there's always going to be things that you want to tweak or improve, or, new payers pop up with new codes all the time. So they've just been wonderful. So I would say if anybody's deciding to go this route, just know that you do have a great team that's there ready to work with you to make this process much easier.
And I think having a committee like we did, or a task force to kind of whiteboard, lay out the process, see what we could change. Like Jen said before, we had processes in place since go live. It's a big change. Laying it all out with folks in a room, kind of figuring out what's the best new direction that we can go in also helps. And also having the staff buy-in and everyone's buy-in that this is a change. It's something that we haven't done in the past, but it's there to be beneficial for us as a whole to help bring in revenue. And then really time is the other thing you need to anticipate, because like we're saying, it does take time to go through these different statuses, figure out what they're trying to tell you, and can you do something with that status. So buy-in with staff, workflowing it out, and time are some of the things to think about.
Yes, and I would absolutely agree with those comments. The buy-in from the staff is so important, because I think as Mark mentioned earlier, when you do this type of implementation, I guarantee you your follow-up billers are going to sit there and think, oh my goodness, I'm going to lose my job. And that's not the intent. The intent is to let them be focused on a higher impact versus, all the minuscule things that they're wasting time on just to find the things that are high impact. So I think it's really important to have, that discussion with the staff and let them know, hey, the goal is to improve the efficiency, not to cut staff. Let's be able to do more with what we have in there. And the other piece of it that cannot be, overstated is the pre-planning. Yale did a great job of this, and it makes a big difference. What we're giving to the providers with the enhanced claim status is a tremendous amount of additional data. And there has to be a plan on what you're going to do with that data. you know, it doesn't do any good just to fill up work queues with all these responses if there's no pre-planning done ahead of time on how you're going to use all that. You know, it's not a magic wand, and you know, I want to make sure everybody understands this is very powerful information. It gets you the information much sooner than waiting for a remit. It's much faster than, you know, someone manually going into a payer's website, but you have to plan ahead on what you're going to do with all of that. So, you know, the staff buy-in and the pre-planning by committee, I just, like I said, you cannot overstate the importance of that process. Like I said, Yale was very methodical in doing this, but they did it the right way. And I think it's always more important to do it the right way than to just do it fast. So that's kind of my closing thoughts with regard to all of that.
Thanks, Rob. So do not underestimate the importance of that pre-planning and, of course, gaining staff buy-in as you are about to roll this initiative out. So that is all the time we have for today. I want to thank Rob, Jennifer, and Mark for their excellent presentation and experience for sponsoring today's webinar. On behalf of Beckers, enjoy the rest of your day, and we look forward to having you join us for future webinars. Thank you.
Thanks, everyone.